Dear distinguished participants, I firstly would like to thank to Aydan Hoca, Haluk Hoca, and especially to Banu Hoca for this very interesting panel. I'm a sleep scientist, so I hope that I would be helpful in just waking you up with this sort of high-pace presentation that I would like to gather about what's going on in Izmir area. Before doing that, there is a fantastic book called Guns, Germs, and Steel from Jared Diamond. Perhaps you've read it, and there you would understand why on Earth, only in the Fertile Crescent, but maybe specifically in around Konya, Çatalhöyük, and so on, this first signs of civilization started. It's a very simple formulation. You needed to have the right amount of grains and right amount of livestock. That is, the goats and sheep. And you can replace the alpha male there, and then the maximum number of goats in the world still are in Turkey, I suppose, about 25 million. Very useful statistics. So with the livestock available as a surplus, you had the time to wait for your grains for the harvest. That needed to be there, and that's the only place that happened. So it's the same thing. So we need to create some sort of a right formulation. Otherwise, even if you've tried, it doesn't go on. So let's go on as a model what we get to know, both the Health Technopark and an international accelerator project that I would like to talk about. We based on a higher Technology Council's decision on the beginning of last year that health area would be prioritized. And with that, additionally, in parallel, we have Expo 2020 from Izmir to have the health innovation in the world for the famous 2020 exposition. But we didn't succeed, even though we didn't succeed. Participating into an Olympics teaches you a lot. So you needed to do lots of road shows, do lots of international agreements and so on to make this. So we have learned a lot. And we also formed Innovis, that's a cluster in Izmir for this technology of industry, academia, and so forth in the Izmir area. So we are actually, we have, I couldn't, but that's okay. I'll continue. A valuable slide from Professor Öztürk is that in the pharmaceutical market and the biotechnology, we have academia in this area, and biotech, and then the pharma companies from discovery to marketing. It's a huge chain. So for a few pennies, acetyl salicylic acid, if you wanted to do aspirin today, you pay billions of dollars. So that chain is not like making a nutcracker. It's not the same thing. From biomedical devices to biopharma, it's not the same thing. So there are different hardships. And if you look at the biotech drugs, in the first column, diagnostic kits, medical devices, biomaterials, vaccinations, and so forth, from exploration to growth in the market, there are levels. That dotted line belongs to most of the basic R&D research that I will connect it to IBG, Izmir Biomedicine Genomic Institute. And then these are the hardships in color in Turkey in the development. So we are not in a heaven. Some of them are the same hardships in the United States, but some of them are specific to the Turkish market. So in order to look at that, if you, for instance, wanted to have for healthy aging a new Alzheimer drug, you need to define the target, let's say beta-amyloid proteins or something with metabolism, and then would do and drug discovery, drug validation, and clinical trials. For all of these, you have huge centers that need to be in concert to make this available. So the project that we are going to do would probably pave a lot of that effort. This is the European landscape for all of the life sciences. So there is 13 main areas. And this is the largest life science research population on Earth. And that large population, from translational medicine to clinical trials and all of these, would be necessary for health technologies, from medical devices to drug research and so forth. And the good thing is that we have already formed in Turkey clinical research infrastructures network, that's TOCRIN. And another good news is that the Turkish government, for the first time, had an international paper declaring that for biobanks, Turkey will be represented. So it's a European representation, but FDA is also part of it, and NIH, so that we are now representing that. The good thing is that BioIzmir would represent both of EKRAN and BBINR of Turkish landscape via Izmir already available. Kemal Baysal, one of the former TÜBİTAK MAM directors, is in charge as a vice coordinator for that next to Professor Öztürk. We have two health technoparks in Izmir. One of them is the dedicated Depark Health Technopark that I'm going to talk about. The other one is Tınaztepe Technopark. The advantage in Izmir is that even though it's a 4 million city, coming as an international airport here, you have a 15-minute drive to these technoparks on the freeway. It's marvelous. It doesn't happen, so you just reach it. And here, all the autobahns, the freeways from Manisa, Denizli, Aydın merge. So you can easily have, in a 1-hour drive, excellent support to all of the regional universities. Coming to 9 Eylül University, we are now with 64,000 students, the largest university in the Aegean area. We have many campuses and medical faculty, engineering, and so forth, and vocational schools. And out of these research centers, a lot of them are now dedicated only to health technologies. So we would like to make this as a service ground for international collaboration and as also a service ground for the technopark companies. There is possibility of silicon chip production, to thin films, to advanced nanotechnology and electronic devices. These could be used for medical devices to be measured, given an accreditation and certification and also production. The Expo 2020 zone was here, the health zone. Even though it's gone, again, by law, it's still a development zone for health innovation. And next to this Çeşme Autobahn, that brings the beautiful Çeşme, we are next Izmir health campus is there, and this is the health tourism area where Norwegians are happily getting their thermal spas and everything by part of their medical insurance. So in this health innovation campus, we have that is an integrated campus. We have a hospital with 1,150 beds and a huge physiotherapy center and a huge R&D center that I will come with Faculty of Medicine, graduate schools, vocational schools. It's an interesting issue. Let me give you what I mean. With this technopark being in the hospital and this Izmir Biomedicine and Genome Institute next door, you have these hospital beds. Let's say that you have a synchrotron here. Next door, only in 50 yards, you have a nucleotide therapy center. That means that with a half time of few seconds, you could just make products that could be for research and therapy. And there you have PET and SPECT, only in, again, 60 yards. And then you have radiation oncology, you have oncotherapy, you have chemotherapy, you have hematology. It's just in walking distance in few tens of yards that you have all of these. So that gives a privilege. If you have a product that, for instance, with ODTÜ, we have now a robotic gait device that will be taken to clinical trials onto human gait analysis and walking for physiotherapy. So all of our beds and all of our surgeon rooms, and this happens to be my lab with 5 senses, that is vision, auditory, the tactile, olfaction and gustatory, integrated to be measured on 64-channel EEGs and other devices. That's the first lab in the world that integrates these 5 senses. So we are in a good, actually, level that would service all of these different interesting research from biotechnology to biopharma. Coming to this is IBG, is International Biomedicine and Genomic Institute Izmir. That is actually the largest investment in Turkey for life sciences in its sense by the Minister of Development. So it has branches of cancer, metabolism, immunity, neuroscience, stem cells, and translational research, and a lot of services, core facilities with omics. These are so critical, some of them are the largest of its size in that part of the world, not only in Turkey. And positions available, that's the good news. And you will be seeing Professor Öztürk, who happens to be also the biomedical coordinator for Turkish American Studies, and Professor Neşat Bey, after this meeting, having meetings for these positions available for these very young, bright scientists that we have over here for coming. So with this former model of existing R&D centers, which didn't help to productions much, we hoped that it would help biomedical and biopharma companies. The institute model now would support from idea to create knowledge, because without a good science, you cannot do anything. You need to have a good science. And we have now private R&D centers that we have interesting programs. That is, one of them is, for instance, we have industrial biomedical PhD program where companies just now go, instead of a thesis, a product is given as a green light with this program. And we hope that with this week platform, we can have BioIzmir, which is a project that I circulated to help it. These are the best, some of the best labs in Europe. If you look at it, it's only on the 5 Western countries of Europe. And nothing exists in the central, nothing is on the eastern part. So in that size, if we can have this project go on, in a 4 million city, we have flight zones, we can reach international programs so easily that this could be an international hub for lots of innovations in that part of the world. Izmir cannot do it on its own. So we can be a gateway, an entranceway, but we need Istanbul, we need Ankara, we need Samsun, Kayseri, Mersin, and so forth as some of the medical clusters and biotechnology clusters. We have already contacted with Irish government. I happen to be one of the 3 external experts that looked at the Irish roadmap for biotechnologies. There is United Kingdom, Norway, Netherlands, Germany, and Switzerland are interested in government level in this project that I've been talking about. And we have in the United States, San Diego for Bio 2014, we are coming for a roadshow there. We've already had contacts with Chicago, Philadelphia, and Massachusetts area. And we have a contact with Hokkaido University in Japan for Hitachi. So from the innovation idea to projects and product to marketing, we need a huge gap. We have a huge gap in biotechnology. Again, it takes a huge effort for the excellent engineering solutions, material solutions to reach to human trials. So these bottlenecks, from design, concept, scientific basis to technical setups and manufacturing processes, we have done many years of study on this. The solution sets are now this biodesign system that we hopefully will do with Drexel University in conjunction with Duke and others. We will have core facilities for supporting, and we have some of the large genomic production, master banks and so forth, and also certified and non-certified labs that doesn't exist in concert in Turkey that will give validation for ministries, for FDA approval, for CE, and so forth. So we hope to build a one-stop shop, a real full-cycle one-stop shop, and we hope to have an international soft landing to Turkey. In order to do that, we have a lot of the infrastructure with accredited labs and a big ecosystem that I've been trying to explain. We have some of the interesting quality control laboratories with Turkish health ministries, İlaç Kurumu, and we would have some science technology ministry, development ministry, TÜBİTAK, some of the programs that hopefully will go through there. And we can arrange clinical trials, which is a big gift for medical devices, technologies, and biopharma. And in order to do that, now we have this project called BioIzmir, next to this technopark. The whole thing is a big technopark integrated into this hospital. And with that, in order to have this international soft landing, we have European Strategic Forum of Research Infrastructures, Biobanks of Europe, translational research, clinical trials, EMBL and ABI, some of the International Sleep Science Technology Association, MassBio, Philadelphia, Hokkaido, and Drexel would have, with some of the support and some of the representations from our colleagues in Ankara, we can play a big role for synchronization and concentration of these efforts. That again, we need a critical mass, and the critical mass in Turkey does not let us now to do it only in one place. So we need to gather all the forces and do it. So we've opened up very recently this large part building of Zeytin, we call it olive, because we believe that that tree would survive for 3,000 years, and after 1,000 years it will still give you fruit, and that fruit is healthy. So the olive building opening, with its first health technopark in Turkey that is integrated in the hospital, would just let you go in a very interesting phase. The Alpha building we've already opened up in the Tınaztepe has now Ericsson MENA headquarters in 1,200 feet. And we have all of these teams in the health, biomedical technologies, biomedical medical devices, and research now doable, achievable today. And so with over $100 million achieved in this project, the series of projects, we can have today TASA scientists open up their services there. But we need a lot of support from these young brains and senior scientists as well. We are opening a fund that's called 950 Business Angel Network, Homeros Fund, together with Ankara. And that's Izmir. Don't be mistaken. It's a beautiful city. Even though it's 4 million, it is still relaxed and it's still beautiful. That's awaiting for you. As Homer said, from Izmir, Smyrna, that's one of the best sunsets in the world, that is. So we hope that with these guys that are waiting for you, with all of these technology transfer projects we've had in the last December, we had over 20 million TL in projects from 1513, 1601, and all of the others. We believe that we can be together with you achieving this goal only if you also supported it and if you also wanted to be part of it. Thank you.